once again, and welcome to the part 2 of Krok 2 2021 booklet. This is July 2021 booklet. This is the part 2. So without wasting much time, let's start right away. All right. So they say a well was dug on a rural land plot. It is located at a distance of 20 meters from the house, then 10 meters from the toilet, and 50 meters from the neighbor's house. What is the minimum permissible distance between the well and the source of possible water pollution according to the sanitary norms? According to the sanitary norms. So in normal soils, the minimum distance between the well and the source of contaminant should never be less than 15 meters. Should never be less than 15 meters. And a distance of 30 to 50 meters is always recommended. A distance of 30 to 50 meters is always recommended. So from this question, what is the minimum permissible distance between the well and the source of possible water pollution? Definitely, we are thinking between 30 to 50, and hence your answer here should be C, 30 meters. 30 meters. All right. The ambulance brought in the victim of an accident who has fallen from a height. So from a height, fell. Now, this patient has clinical signs of multiple fractures in both limbs. The patient's condition is severe. Patient is conscious, but mentally sluggish. The skin is pale gray. The forehead is covered with a cold sweat. Patient's breathing is shallow with a respiratory rate of 30. Blood pressure 80-60 is going down, isn't it? Pulse of 120. So all of these things are just telling you that this patient is in shock. Patient is in shock. Why? It could be because of there could be a lot of blood loss. Don't forget, they said there are multiple fractures in both legs. Multiple fractures. Anytime there's a fracture, there's always blood loss. All right. And it can be estimated that if you have a femoral fracture, you are losing about 2 liters of blood. So I don't know. For this question, they didn't tell us which area that they had a fracture, but they said that it is in both legs. So it could be in the tibia, the fibula, or the femur, right? So basically, the patient has lost a lot of blood. That's why the patient is pale, is sweating, pulse is high, blood pressure is going down, respiratory rate is high, breathing is shallow. So definitely, this patient is in shock. This patient is in shock. So we call it what? A traumatic shock, because it is as a result of what? A trauma. What's a trauma? Trauma is the fact that the person fell from a height. The person fell from a height. So this is definitely what? A shock. And shock simply refers to the inadequate perfusion of tissues due to the imbalance between oxygen demand of the tissues and the body's ability to supply it. So when the tissues in the body are not perfusing very well, or are not getting the adequate amount of oxygen to be able to carry out their activities, then we say that this particular patient is in shock. Is in shock. There are different ways of classifying shock, but I don't want to dwell much on it. I just want to focus on the degrees of shock, because classically we can talk about hypovolemic shock, cardiogenic shock, obstructive shock, distributive shock, and so on and so forth, and so on and so forth. But for this one, I want to just focus on the degrees of shock. The degrees of shock. So you can write these things down so that it will help you when you're analyzing them. The degrees of shock. All right. So we have the first degree. So in first degree shock, there's a volume loss of up to 15% of the total blood volume. So it's just 15%. And this is approximately 750 mils. 750 mils. And then the heart rate over here would be minimally elevated or even normal. minimally elevated, or even normal. And over here, there's no change in the blood pressure, the pulse pressure, or the respiratory rate. That means that everything will seem normal in a first degree shock. So definitely this patient is not a first degree shock. So let's move on to the second degree shock. In second degree shock, there is a volume loss about 15 to 30% of the total blood volume, which means between 750 mils to 1,500 mils. So if this amount of blood is lost, then we are looking at what? A second degree shock. And over here, the heart rate and the respiratory rate will become what? Elevated. To become elevated. Normally, the pulse will be somewhere more than 100 beats per minute, or it can even get to 120 beats per minute. And for the respiratory rate, you are ranging between 20 to about 24. 20 to about 24. And that is what? Second degree shock. 20 to about 24. All right. Then the pulse about 100 to 120. So you can see that this question, in a way, it falls under the second degree shock, right? Even though over here the respiratory rate is 30, but we are saying that in second degree, you should be having around 20 to 24. Now, over here to the pulse will also become narrow, all right? The pulse also become what? The blood pressure will become, how do I put it? Usually the blood pressure will change a little bit. Blood pressure will change a little bit. And sometimes it might not change, okay? But normally there will be a change. It will be decreased, okay? It will be decreased. It will be decreased. It will be decreased. But sometimes it might not even change. But over here, it will be decreased. All right. So that is class 2, or the second degree shock. Now, we also have, again, in second degree shock, I've already told you about the pulse. Okay, so that's it. All right. So let's talk about the third degree shock. Third degree shock. So in third degree shock, what do we see? We see that there will be blood loss of about 30 to 40% of the total blood volume. That's 1,500 to 2,000 mils. 1,500 to 2,000 mils. Over here, there will be a significant drop in the blood pressure, and there will be a changes in the mental status. There will be a changes in the mental status. Now, the reason why over here we'll go in for the second degree, not the third degree, over here, the question says what? The patient is conscious. Patient is what? Very, very what? Conscious. Just that the patient is mentally what? Sluggish. But the patient is fully conscious. In third degree, consciousness level will drop. Conscious level will drop. So that's what should come into your mind. The heart rate and respiratory rate will also be elevated. The heart will be more than 120. Then the respiratory rate will also be more than 24. To be more than 24. More than 24. There will be a delayed capillary refill. Delayed capillary refill. And then finally, in the fourth degree stage, there's volume loss of more than 40% of the total blood volume, which means that definitely there will be what? Hypotension. There will be what? Hypotension. Tachycardia will be so pronounced. The mental state will become increasingly altered. Urine output will be minimal or even absent. So these are some of the parameters you are looking for when you are classifying your what? Your stages or the degrees of shock. Over here, you can't get everything in the question, but yet there's a few things that you can see that this one there, it would be second degree rather than third or fourth degree. And that's over here. We are going in for the second degree. Second degree. A 30-year-old patient, after an emotional upset, developed a tonic seizure that later gave place to a clonic seizure. This condition was accompanied by a loss of consciousness foaming at the mouth, involuntary urination, no focal signs were detected, blood pressure was 120/60, make the right diagnosis. Definitely, you are looking at a problem with nerve cell activities in the brain. Problem with nerve cell activity in the brain, which can possibly lead to what? The seizure, which will lead to what? The seizure. And over here, we are definitely looking at what? Epilepsy. We are looking at epilepsy. We are looking at what? Epilepsy. All right. So over here, your answer will be B, epilepsy, epilepsy, or status epilepticus. So a full-term delivery has resulted in the birth of a live full-term girl without asphyxia. The baby is inert. Her skin is pale with an ecteric tinge. That means, sorry, with an ecteric. That means there's yellowish discoloration, all right? She has no edemas. The abdomen is soft. The liver and the spleen are enlarged. The blood tests show that the mother's blood group is A negative. Guys, blood group is A negative. If you have watched our other tutorials, you will realize that these are some of the things that we call what? ABO incompatibility or resource incompatibility. So normally you get more of the ABO incompatibility when the mother's blood group is O, and you get more of the resource incompatibility when the mother's blood group is negative, or when the resource is negative. All right. So over here, that's what we're looking at over here. So over here, the child's blood group is what? Is A positive. Make the right diagnosis. Definitely, we are looking at what? Resource incompatibility. Resource incompatibility. And that will lead to what we call hemolytic what? Disease of the newborn. So over here, your answer is what? Hemolytic disease of the newborn. And this is caused by what? RH incompatibility or resource incompatibility. This is not ABO. No, this is resource incompatibility. Why? Because mother's blood group is A negative, whilst child's group is what? A positive. And especially if this is the second child or fourth child and things like that, there can be what? Problem if anti-D wasn't taken. If anti-D or Rogram wasn't taken. So you can look for Rogram or anti-D. Anti-D is the antidote for resource negative. All right. So we give to a pregnant woman so that they will not let the baby go through that kind of reactions. All right. So we have the region in the Carpathian foothills is characterized with constant high atmospheric humidity of over 80% in the cold season, while the air temperature is moderately low. The population of this region feels extremely cold, guys. You are feeling cold. What type of heat transfer increases in such condition? Definitely, anytime hearing of what humidity of more than 50% and things like that, one of the things that comes to my mind is definitely what we call what? Convection. And convection is simply the transfer of heat from one place to another by the movement of fluids. The transfer of heat from one place to another by the movement of fluid. And always convection requires the current of gases or liquid. It always requires some of these things. So normally to dispatch the heat, the body surfaces shall be airflowed at a temperature lower than the temperature of the skin. So what I mean is that when the temperature of the environment, all right, is lower than the body temperature, then heat begins to emit out. All right, and that is what we call what? Convection. It's all about what? Body, it's all about fluids, air and fluid, air and water. Let me put it that way, or air and fluids, basically. All right. Now, if you're thinking about evaporation is when the dispatch of heat to the environment via sweat, or evaporation of moisture from the skin and the respiratory tract mucus. Normally, when there's heat, too much heat, there can be the transfer of heat or energy from the surface of the skin into the atmosphere. And that's called what? Evaporation. That is called evaporation. So please take note of some of these things. When it comes to radiations, normally this with what? Internal energy in the form of electromagnetic wave. Internally, that's when it's internal. Internal energy transfer. Internal energy transfer. And of course, conduction is from one surface to another, or from one how do I put it? Just like when you are cooking food, okay, and you put the silver or whatever it is on the stove, the heat, when you touch the silver, you see it will shock you. Yeah, because there's a heat that is transferring from the silver or your pot into your hand. That is called what? Conduction. So get to know the differences between some of these things. So over here, you are looking at what? At convection. Convection. So we have a 58-year-old patient complaining of an inguinal tumor that increases during straining and coughing. So for me, anytime I hear of these things, ideally what comes to my mind would be a hernia. All right. Some of it comes to my mind, automatically comes to me is a hernia. But let's read and see if it is a hernia. All right. Or if it's not, because it can be a lot of things, it can be a lot of differentials. But for me, one of the comes to my head was hernia. But of course, they told that this was an inguinal tumor. Of inguinal tumor. So it's like a tumor or a mass. Now, look at the keyword here. There's what? Pulsating. That's on examination. No? There is a pulsating tumor-like formation located below and laterally to the palpus ligament. Pulsating. What pulsate? What organ pulsate or what structure pulsate? A vessel. Guy, it's a vessel that pulsates. Right? So pulsation deals with what? Vessels. So whatever, now what I'm thinking about is, I'm thinking about what? A vessel or an artery, a vein. That is what I am thinking about. That's all. So there's no more about hernia, right? Because hernia don't pulsate. They don't. Hernia is when abdominal content actually coming out through the inguinal canal. But over here, they say it is pulsating. So it could be the aorta, right? The abdominal aorta. It could be the abdominal what? Aorta that is giving rise to the femoral arteries and all those kind of things that is causing this 58-year-old patient problems. So that is what comes to my mind. The information does not diminish during palpation. So you see, make the right diagnosis. Definitely, I'm talking about an artery. And over here, what I'm looking at over here, that is the most likely answer, will be what? The femoral aneurysm. Femoral aneurysm. Femoral aneurysm. As simple as that. So this is not a femoral artery. It's an artery. It's an artery. It's an artery. All right. A variety of lighting fixtures have been used to illuminate classrooms. What kind of lighting fixture creates the most hygienically acceptable lighting? So it's like when you're in your classroom, what kind of lighting is the most preferred in the classroom? Definitely, we call it the LEDs. The LEDs or the LED or the light emitting diode. Diode, D-I-O-D-E, diode. Light emitting diode or LED. These are the best man-made light for the classroom. They are the best man-made light for the classroom. But of course, the best light is always what? The natural light. Natural light. Natural light. However, with what we're talking about here, definitely they're looking for what? Man-made kind of what? Light. Man-made kind of what? Light. And that's why we're using what? LED. And then LED is an example of a reflected type of lightning. It's an example of a reflected type of lightning. And that's over here. We are going in for A. Lighting feature that provide a reflected lighting. Again, the name is what? LED, LED. LED. All right. A victim of a car accident received multiple fractures. So again, another multiple fractures and pelvic bones. He has a history of hemophilia A. So hemophilia tells you that there's a factor 8 deficiency. And factor 8 is simply a clotting factor, right? It's a clotting factor. So factor 8 is deficient. So, and again, I've said a countless number of times that to treat hemophilia, you are looking at what? Fresh frozen plasma or cryoprecipitate. Fresh frozen plasma or cryoprecipitate. That is what always comes to your mind. That's what always comes to your mind. Well, objectively, hematomas form at the site of injury. The patient's condition is deteriorating. The blood pressure is 90/50. That means the patient is going into shock because of the what? The bleeding or the hematomas that are being formed. Now, what is the optimal combination of infusion agents that should be given to the patient for the treatment after a dextran and saline solutions are administered? So you are giving your IV fluids, all right? You are giving them. Now, what other thing will you need to give to this patient? So right now, what you would need now is to make sure that the patient is getting his or her, patient getting his or her what? Her cryoprecipitate or fresh frozen plasmas. All right. And of course, patient has lost blood already or could have lost blood already because there are hematomas that are being formed. But this blood is not coming out. It's inside the person. I repeat, the patient is losing blood, but the person is not losing volume of blood because the blood is forming hematomas or they are accumulating inside the tissues. There's a difference. And that is why over here, you don't want to give whole blood to replace the loss of blood. You give what are called packed cells. You give what are called packed cells. You give what are called packed cells. And that's over here. You are thinking more of what? Cryoprecipitate and packed cells or packed erythrocyte. Cryoprecipitate or packed erythrocyte. These are some of the things you are looking for. These are some of the things you are looking for. Of course, if you have fresh frozen plasma, you have cryoprecipitate, we are going forward for the cryoprecipitate. We are going forward for the cryoprecipitate. All right. But there can be a confusion with, because you have fresh frozen plasma and you have cryoprecipitate. Which one will I use first? The cryoprecipitate. All right. So we have a 40-year-old woman, gravida 6, Damsha had 6 conceptions, para 3, give birth to 3. So what happened to the other 3? Let's continue. So at the 40 weeks of her pathological pregnancy, there was threatened abortion. Type 1 gestosis of the second half of her pregnancy gave birth to a girl with asphyxia. Okay, the baby's condition is severe. Weight is 2 kg. There are signs of immaturity and hydrocephalus. Baby's skin is pale, ecteric, acrocyanosis. Heart sounds are muffled. There are a harsh systolic murmur at all points of auscultation. This one you could say machine-like murmur. Machine-like murmur or pansystolic murmur. Pansystolic murmur. All right. Good. Now, abdomen is enlarged, the liver is +3, urine is saturated, the stool is light colored. An ophthalmologist has the guys, now this is your clue. All of these things, this is where you need to take note. An ophthalmologist has detected chorioretinitis. Chorioretinitis in the baby. Make the right diagnosis. Now, a chorioretinitis is an inflammatory process that involves the uveal tract of the eye. The uveal tract of the eye. Now, in neonate, the inflammation is usually caused by a congenital viral, bacteria, or a protozoal infection. Again, it's caused by a congenital viral, bacteria, or protozoal infection. And normally, what you're looking at for is toxocondi and then cytomegalovirus or CMV. These are the leading causes of congenital infections associated with chorioretinitis. So over here, since I'm not seeing CMV or cytomegalovirus and I'm seeing toxoplasmosis, definitely that will be my answer. So your answer here is D. A woman at 12 weeks of her pregnancy developed a pain in the lower abdomen and a mild bloody discharge, which occurred with no apparent reason. So I always tell my student, anytime a woman is pregnant, especially in the first trimester, developing low abdominal pains with discharge, abortion is coming. Abortion is about to set in. So you have to act really fast if you really want to save the pregnancy. That is, if at the time the patient presents, you can save it or you can save the pregnancy. So they come too late when everything has come out or when the cervical os is opened. That one, nothing you can do. All right. But let's continue. So vaginal examination shows a well-formed cervix with closed external orifice. That's very good. So if the cervix is closed, you don't have a problem. That means what the patient is going to, we call it a threatened abortion. Because it's an attack. If care is not taken, the way the cervix opens, forget it. It's imminent miscarriage. It's going to happen. It's just going to happen. As soon as the cervix is open, it's going to happen. All right. So over here, when a patient is in this kind of condition, you want to give, you want to control the pain, of course, and also give a progesterone analogs to help with the pregnancy or to help in the protection or development of the embryo or the baby. Sorry. All right. So over here, we're looking at what? At a threatened miscarriage. In my other videos, I've talked about the different types of what miscarriages. We have the silent miscarriage, we have the imminent, we have imminent or inevitable, we have the incomplete, the complete abortion, we have the missed abortion. All of those things are all there. So please find time to go to some of my notes and you appreciate some of these things better. All right, and this brings us to the end of our presentation. I hope you enjoyed it. If you want more, please make sure you have subscribed to this website. All right, medentweb.com. Thank you and stay blessed.